this first lecture, this will be labeled multiple things. Number one, introduction, legal issues, some basic terminology. We'll cover multiple things in this. So with this, hopefully you've printed off your sheet, your first worksheet number 1. You have read the chapters that are assigned to that. You have gone and filled in as much as you possibly can, and hopefully this will help answer some other questions. I felt that this would be a good thing to videotape so that it gives a little bit better in-depth look at what we're wanting to get in the content of this course, because if you've seen on your syllabus, there are multiple chapters involved in this first lecture, and kind of focus on what we talked about in the lecture today. So the first thing we'll look at is, what is a trainer? So when I say that and I throw that term out to you, what do you think of? Trainer. What's it mean to you? If I say, hey, did you see your trainer today? What's that mean? To an athlete, it means one thing. To a wellness and fitness person, it means another. And then it means something totally different to someone who works in the equestrian field, so as a works with horses. So when we say trainer, it means multiple things. It could be a personal trainer. It could be an athletic trainer, which this content of this course will be geared toward. A dog trainer, horse trainer, a certified strength and conditioning specialist. Trainer can mean anything. So let's get rid of some of the confusion and start calling things what they are. If it's a dog trainer, say dog trainer. If it's a fitness trainer, say fitness trainer. If it's a personal trainer, say personal trainer. If it's what we're talking about in this course, athletic trainer, then by all means say athletic trainer. Athletic trainer is a trained allied health professional that deals with the prevention, recognition, and or care of athletic, or most of the time now we say just care of injuries and illnesses. It used to be confined to athletics, and now it has broadened and gotten to many other fields outside of athletics and deals with clients and patients that aren't athletes. So athletic trainer refers to an allied health professional who's been trained to deal with the prevention, recognition, and care of injuries and illnesses. We want to take care of things that are wrong. We want to recognize when things are wrong. An athletic trainer is someone who has gone to a 4-year degree school, has a bachelor's degree. They sit for their national exam, and they can be called a certified athletic trainer. You can also gain state licensure. Many states will not allow you to practice unless you're a certified athletic trainer, meaning you have a national certification. When we start talking about national certification, we want to look at a couple of things. And we want to debunk the myth, first of all, that we do sports medicine. The term sounds great. It's flashy. It seems like you're high on the chain of who you are. But an athletic trainer is part of a sports medicine team. Think of sports medicine as the umbrella. And if you look at the umbrella, and the athlete is the pole, that's the handle. Everything this umbrella does, everybody involved in this sports medicine umbrella helps take care of the athlete. So let's look at a few people. First of all, the athletic trainer. The athletic trainer oftentimes is the first person, the very first person to see the injury. They're the first person that's told about an injury. They're trusted. They're confided in. You have a lot to deal with what we call HIPAA regulations. H-I-P-A-A, HIPAA regulations. And that's one of the things you'll need to look up. What is HIPAA? And how does it deal with the athletic trainer? HIPAA is a privacy act. It's confidentiality. We can't just tell anybody information. If an athlete gets hurt, I cannot tell the coach what's wrong with them unless they give me permission to do that. I cannot tell their parent if this person is over 18, what's wrong with them unless they've given me permission. So with this, athletic trainers deal with a lot. They're probably the closest to the athlete of any of the personnel that deals with an athlete. Then we have our doctors, medical doctors, whether it's an orthopedist, a dentist, ENT, ear, nose, throat, eye doctor, podiatrist, family physician, dermatologist, any of the physicians. We need to be able to, as an athletic trainer, talk to these different physicians. We need to understand what they're saying. Many times you go in a doctor's office, it seems like they're talking a different language. As an athletic trainer, we need to understand that language. We need to be able to talk in that language, but at the same time, we need to be able to tell this STEM, the athlete, the patient, what the doctor just said. Be able to explain that to them in plain words. Be able to explain that to the parent. Other people involved, physical therapists or sports therapists, nurses, coaches. Coaches are a very important part of this team because if they don't support what we're doing, they're going to push the athlete to do something they shouldn't be doing. They definitely need to buy into what athletic training is and what we're trying to do. The chiropractor. Chiropractic care is becoming a very popular care in athletics now. To have a chiropractor as it's a doctor of chiropractic, one of your staff that helps take care of the athlete. They're part of that sports medicine team. Nutritionist, exercise physiologist, certified strength conditioning specialist, self-explanatory. Certified strength conditioning specialist will be one that helps train the athlete. They're the ones making them stronger, faster, jump higher, that type of thing. One I don't have listed here is a psychologist or counselor. Always have one of them on your list as part of that umbrella because you will have to consult them. We'll talk about some things throughout this course that the counselor is very important as a consulting person. Not that we tell them who has the problem. We just say, I've got this going on. What's your advice? What do I need to do? How do I approach this person? How do I get this person that has an eating disorder to come and see you and get this taken care of so we can give them the best care possible? So when you think sports medicine, think the umbrella. That's everybody. Then you have your athletic trainer, your doctors, your physical therapists, nurses, coaches, chiropractors, the whole gamut of people. For the athletic trainer, we are regulated by agencies. The first agency we'll talk about is NATA. On your list, you'll have this one to look at, National Athletic Trainers Association. If you have that list out on that first worksheet, National Athletic Trainers Association, NATA.org. www.nata.org. Look it up and see what it does. They'll track membership. We'll have several things listed. There's a job vacancy listing there. We can go and search for jobs. That's a professional membership. Separate than that, NATA does not certify athletic trainers. Those that certify athletic trainers is the Board of Certification. Board of Certification writes the examination that we have to pass on a national level with minimal proficiencies and competencies, which are taught in a 4-year accredited program. The only way we take this test is go through an accredited program, and at Marshall we do have one. And by taking this exam, you are what we call credentialed as an athletic trainer. You are a certified athletic trainer. It may be listed ATC or CAT, either one. Certified athletic trainer or athletic trainer certified. The BOC also tracks continuing education to make sure that we're keeping up with things, making sure we're going to conferences, making sure we're continuing our education. So they keep us licensed as well as the initial passing of the exam. There's a code of ethics. Go to the BOC, it's www.bocatc.org. Again, it's www.bocatc.org. And at this site, you'll find several things. Number one, what you need to do to be able to take their exam. 2, the schools that are accredited. 3, there's a thing called ethics in athletic training. There's a list of ethics and what they are, what you have to turn in, what you have to abide by to practice as an athletic trainer. We have to turn in continuing education units, 80 contact hours of continuing education every 3 years. Really 75, and then 5 of that's given as CPR recertifications. You recertify your CPR each year, and then it's up being 5 CEUs of your continuing ed. Aside from the 2 agencies here, separate identities, but both involved with athletic trainers, multiple other allied health agencies support and indirectly can regulate athletic training. If a medical association, let's say for instance the AMA, American Medical Association, the first one on this list, they recognize athletic training as an allied health profession. And in doing so, that gives credence to an athletic training. That gives us validity, that we are an allied health profession. If they had not recognized that, then it could still be out there multiple ways. An athletic trainer is a trainer versus an athletic trainer is a professional allied health person. This person has been trained in that. So American Medical Association is one of them that helps set standards of care. And in setting standards of care, if you want to stay out of litigation, you want to make sure you're going by the standard of care that's appropriate for what the injury is, or what you're allowed to do in your practice. And the AMA has a lot to say in that. American College of Sports Medicine, ACSM, a lot of research into injuries, tracking of injuries, dealing with those injuries. So it really deals with sports medicine at the college level and is very research intensive. So you find that site, list that site on that sheet like you're supposed to do, and kind of tell what their purpose is from the site description. International Federation of Sports Medicine, FIMS, does a lot on the international level promoting athletic training and sports therapy at the international level, and can have some influence on athletic training, especially in other countries. American Academy of Family Physicians, American Academy of Pediatrics, both have a lot to say in what's going on in things. Both can impact. If you take the AAP, AAFP, and AMA, a lot of impact on the scope of practice. When they all support athletic training as an allied health profession, then, hey, it is there, it is at that level, it is an allied health profession and needs to be recognized as such. So these other agencies, and there's some others on your list you'll look at, deal a lot with things that impact athletic training and how we practice athletic training. Multiple others we could talk about, and you'll look some of those up yourself. Job opportunities in athletic trainer. First of all, we'll look at kind of the traditional ones, and traditional ones tend to be, okay, go work in a college, high school, professional, we'll put Olympic there with professional sports teams. You're employed to work with the sport team, treat injuries, try to prevent injuries, taping, bracing, do rehab, those types of things. That's your traditional settings. There's a lot of them. Probably the fastest growing one right now is the high school. Your best paying of a lot of these, believe it or not, initially is high school. Some of the professional ones, when you get into some other things, along with your normal pay, can have some pretty good salaries. Some people say, I want to work my way up to professional. Well, what do you mean by work your way up? To me, working your way up is probably high school, because that's probably your diverse and most dynamic group of people. They're growing, their brains are growing, their bodies are growing, they're changing, they're going through trying to please people, they're learning the sports. There's a lot of differences in these. So you really have to think about what's traditional and what's non-traditional. The next one we'll look at is we'll look at non-traditional. When looking at non-traditional, you have to take into account multiple things. And I'm plugging the electric cord into the projector here right now so we don't lose power here in a minute. That way the battery doesn't go dead. That's why that camera just moved a little bit there. But anyway, non-traditional. One of the first things I'll say, many people today are going dual credential. When they say dual credentialed, I mean they are actually going out and getting athletic training certification, but at the same time they're going and getting another certification. So they're going on to PT school, they're going on to medical school, they're going on to multiple other things that will allow them to practice in more than one thing than athletic training. So they're going out and getting credentialed as an athletic trainer and then getting credentialed as a physical therapist. I have a good friend who's a physical therapist, as a doctor of physical therapy. He tells everyone if they want to go to physical therapy school to do athletic training as an undergrad, because it prepares you the best of all the undergraduate degrees. Same thing with medical school and some others. So being dual credentialed makes you marketable. Just something to think about. Different non-traditional settings. Hospital settings, as an athletic trainer, you can work in administration in a hospital, work as a physician extender, so you're seeing patients under the supervision of a physician. In a clinic, you're in a physical therapy clinic, you own your own clinic. One clinic has opened up recently that I know of is sports physical therapy, and it's all athletic trainers. And they're doing very well. And it's pay for service. They don't bill insurances, they just flat out say, if you want this service, you'll pay me X for each treatment. It seems to be going over rather well. Other clinics will use them, and some clinics you bill like a physical therapist or PTA or occupational therapist would, and that you bill insurance companies. So you can work in a clinic and do that. Some other people don't think about are NASCAR. So you work with pit crews, working with injuries, taking care of injuries. You work with NASA, take care of injuries, same thing. Most of these are dealing with injuries, taking care of injuries, reducing work environment injuries by going and looking at ergonomics, those types of things. Theme parks, Disneyland. Along with that, looking at Disneyland and others, you think of corporations, it kind of falls under industrial rehab. So you go into a steel mill or any of these places and they buy all the equipment and supplies and they hire you to do all their rehab. In the long run, their insurance premiums come down because they're not having workers' comp claims for all of the rehab. And it saves them a lot of money in the rehab and can be a good, very good work environment for you. Working with equestrians, so you're working with horses. New York Ballet, like equestrian, they would you do rehab, you do strengthening. You have to study and know a lot about the horses themselves. So maybe some extra education in that for you. Use ultrasound, therapeutic ultrasound, things like that. New York Ballet, again, just looking at the performing arts. It's another place that seems to be becoming a little more popular for athletic training, is getting with the performance arts. As you can see, pictures here, traditional, maybe non-traditional, where you're more in a clinic, it's a controlled environment, or think of physical therapy. Legal aspects. With anything you do, there's always a chance of being sued. That's the interesting thing about the world today. The new lottery of 2007 is lawsuits. Just sue them. If you think you were wrong, sue them. There are times to sue and times not to. But you need to be aware of things, what you're going to be sued for, and the terminology of what's going on. So let's look at some of this terminology and see if we can make some sense of it. The first one we're going to look at is liable. Someone says, you're liable for what you did. That just means you're legally responsible. And we'll want to add some qualifiers to this. Are you really legally responsible for that or not? And we'll talk about that in just a second. Malpractice. You did negligent care or treatment. Okay, what's negligent? So you're saying you're liable for your malpractice. Well, we've got to determine what negligence is first. See if I'm even liable for the fact it was my responsibility or not. Number one with negligence is the definition. Negligence is the failure to offer reasonable and ordinary care, being a prudent person. You do what you're trained to do. So if somebody else was trained in the same thing, they're a board certified athletic trainer just like I am, then that's the standard I'm held to see if I'm negligent or not. And how they prove my negligence is, number one, did I have a duty to act? Was that part of my job to do something? Number two, did I breach my duty? And number three, was harm done? So did I have a duty to act? Did I breach the duty? And was there harm? That's if I'm negligent. If I'm negligent, then, okay, did I commit something? Did I do something that was negligent? Or did I omit something? So act of commission, act of omission. Act of commission is, think of several things. I did something I shouldn't have done. Number one, a misfeasance. I made a mistake. I'm allowed to do that. That's in my scope of practice. I've been trained to do it, but I made a mistake in what I did. The second one is a malfeasance, a gross error. A gross error, malfeasance, is something that is outside of my scope of practice and I did it. So I did something I'm not trained to do. That's a malfeasance. So malfeasance and misfeasance. The next one is act of omission. I omitted something. I did not do something I knew I should do. We call that now a non-feasance. I did not do something, non-feasance, did not do something I knew was a standard of care. I left a step out. I didn't do it. I just elected not to do it for whatever reason. Non-feasance. The last one I'll talk about on here is vicarious liability. When we just go out and say, well, we'll just get people to help out with athletics. We'll teach them how to tape, we'll teach them how to do that, and let them do it. Send them off with the team and leave them by themselves. You are in a heap of trouble. You are setting the environment for something to happen. Number one, you have a non-credentialed, non-licensed person practicing athletic training in Ohio, Kentucky, Tennessee, along with every other state except for about 4 states in the United States now. They are practicing without a license, and it's against the state law, and it can be a misdemeanor or felony depending on the state you're in. The second thing is vicarious liability. Liability in place of another. If I go out and get these students to help with these things, and I send them off with a team, I'm liable for what they do. liability and placement of it. So if they go out and do something, they use a modality, they put ultrasound on somebody, and they use ultrasound, and they do it wrong, and they hurt them or burn them or do something, then I'm liable for what they do. Yes, they are going to have, they can be sued for it, but I can also be sued because I allowed them to do it. As an administrator, you're liable for your athletic trainer for what they do. So you need to know what the scope of athletic training is, what they should be doing, what they shouldn't be doing. I'm not saying everything about athletic training, but you need to be aware of what's going on and make sure you hire reasonable, prudent people that's going to practice within the scope that athletic training is and not get outside of that scope. If we're starting to prescribe meds, we're starting to give injections, that kind of thing, that's outside the scope of athletic training unless you're dual credentialed and you're practicing under your other credential to give meds or to give injections, because you're allowed to do that in that scope of practice, not in athletic training. So be careful. Number one is, do I even want to do anything for someone? Well, if it's my duty to act, yes, I have to. That's my job. If it's not my job, then okay, I can volunteer, but don't go beyond anything you've been trained in. If you're not trained in it, don't do it. Is the best thing to think of. Even with first aid, the definition of first aid is to offer immediate and temporary care to a more qualified person takes over. Let me say that again. First aid is offering immediate and temporary care so another person can take over, a more qualified person. That is not someone that tapes ankles. That's prophylactic bracing, and that's gone beyond first aid. You will get yourself into a liability issue there. So if you're sued, number one, keep quiet. Don't go talking to anybody unless it's your supervisor, your lawyer, or your malpractice insurance carrier. You don't go talking, blabbing your mouth. You don't go saying, hey, so-and-so sued me for this, and I did this, I did that. Keep quiet. That's why when something happens, you'll see it reported on the news, and all of a sudden nobody's commenting. That's why. They don't comment because they want to get their ducks in a row, get their paperwork together, and try to defend themselves. So number one, keep quiet. Notify who needs to be notified. Your supervisor, your lawyer, your insurance carrier. Only those that you need to notify. Secondly, documentation. One of the things we'll actually talk about and look at is soap noting. And that's a way to document athletic or just injuries or illnesses. You document in a certain order, certain things you have in that documentation. And I will say this, we don't document enough as a medical community. As time goes on, you forget what you did. You forget who was there. You forget what was done, who did what. And if somebody comes back and sues you, you need that documentation to go back and read and remind yourself what happened. You can't go back and document it 6 months later because you've forgotten 90% of what happened. You may remember the big things, but you've forgotten all the little things, like what was the weather like outside that day. Besides the weather, what was the temperature? What was their attire? Were they in full pads and helmets, or were they just in helmets only and t-shirts and shorts? You need to know all that, document all that on an injury, so that if something comes up, you know what happens. Or if it's something really crucial, you know something you had to call an ambulance. Anything called ambulance for, document. Make sure everything's documented until you're sick of documenting. We don't document it. You never document too much. And then the next thing is building a defense. If we're sued, we keep quiet, we notify who we need to notify, we start collecting all this documentation that we should have already done, and then we build a defense. Contributory negligence. Did they do something that contributed to that injury? If so, then what they did. Document that. Document they were trained and told and watched the video and signed things not to spear, not to lead with the helmet in football. But yet they did it anyway, and now they're a paraplegic or quadriplegic. Contributory, they contributed to it. Good Samaritan. That protects you if you're volunteering. It's non-paid. In some place you need to know your state laws. Each state law is a little different on the Good Samaritan law. And you practice within your scope. So you volunteer and practice in your scope. And then lastly, assumption of risk. It's assumed there is a risk. There's an inherent risk when you do activity that you could be injured, you can fall ill, you can die. Yes, death seems severe, but injury and death is a risk people take with anything they do in activity. So that needs to be said. They need to sign these things saying that. So when you're trying to do things, once you're sued, then you need to come up with this whole list of things and build a defense. You do that with your lawyer, with your supervisors, and then continue with that. Preventing lawsuits is an even better way to go. The first thing we'll look at is waivers. With waivers and consent forms. A waiver is something I'm not holding you responsible if I get injured. I understand that I can get injured. I consent that I've been told I've been injured. However you want to word it, there's multiple ones out there. One for like the YMCA and some others. Fitness centers, they use what they call a PAR-Q, P-A-R-Q form. And there's certain things you fill out. If it's yes, then no, you cannot come in our facility until you get physician clearance. If everything's no, and you sign that this is truthful, then it's basically a waiver. And it's a way to try and protect yourself. Pre-participation screenings is another really good one, often called a physical. Physicals are more in-depth. It's keep them called pre-participation screening because we screen. If there's anything we catch in the screening, we get further clearance from the professionals. It includes health histories. So we want to know their family history, death before the age of 55, smoking, diabetes, high blood pressure in the family, those types of things. Personal history. Do you have high blood pressure? Do you smoke? Do you consume alcohol? Several things. Gender specific. One of the biggest things with gender specific is, especially with male to female, with female when's their last menstrual cycle, that question should be asked because that has a lot to do with, especially endurance athletes. You don't want somebody to go without a menstrual cycle for a long period of time. It can have detrimental effects. Physical examination. So actually we'll put our hands on them. Musculoskeletal. It's your orthopedist, your athletic trainers, your physical therapists, your nurses. We do all this kind of thing. And also cross over to internal medicine, blood pressure, height, weight, pulse. We listen under internal medical. We listen to heart, listen to lung sounds. You should have a cardiologist available in case you need clearance. But your family practice person should be listening to these things and can catch it in the screening. We check eyes. We check multiple other things with this physical examination. They may even do a urinalysis to look at protein or blood in the urine. And why is there blood in the urine and can it be explained? It can be maybe explained by gender differences. It could be explained by they went and lifted weights that morning before coming to the preseason screenings. So we need to do this in preventing a lawsuit, number one, but anyone that is going to participate in your athletic program at all. Includes athletes, should include cheerleaders, should include a mascot. We had a mascot with a pacemaker in an arena football game and started going into tachycardia, meaning increased heart rate. Could not get it slowed down. Ended up sending by EMS. He was fine, but he had no screening prior to coming out. There's no way he'd been allowed to get in that costume indoors in the heat that we were in. So no matter who it is, dance team, even think about your band. Because a lot of times your band, they're out there in these hot uniforms on a hot day and can have illnesses. You need to know if they're diabetic. You need to know if they have allergies. You need to know these types of things about them. So they should all have this pre-participation screening, whether they're in band or the athlete themselves.